So 41-year-old man who is a pipe fitter and who has come all the way from UP and stays here in Nargetpalli working on fitting pipes with a company, with a contractor who has a lot of government companies, pump house orders. So what is happening here is he used to take alcohol, and when he takes alcohol he takes it for a at a stretch, day 1, day 2, day 3, day 4, day 11, like that, and then he gives it up. And recently he went home, I think 2 months back, and he took it for 11 days, following which he had a lot of giddiness, and then he developed anxiety symptoms and all. Now he is basically having a lot of anxiety symptoms, giddiness. In fact, very strangely, he was squatting in our OPD because he said that he feels better with squatting. So we were wondering what's going on. So we checked his cardiovascular system, and we found only thing was that there was a prominent S4 which disappeared after which increased after he stood up. When he was squatting, that S4 had vanished. But when he stood up, the S4 came in prominently, and we were thinking whether he is having some LV dysfunction when he is standing. Now the ECG is plus minus LVH, chest X-ray is also plus minus LVH, but chest X-ray was suggestive a little bit of prominent pulmonary arteries. So just let me look at the pulmonary artery. Yeah. So right inferior lobar branch was prominent in the X-ray. In this view, we are looking at the RA, right ventricular outflow tract, and the pulmonary artery here. Not so prominent. The main pulmonary artery could be a little. Not this one, isn't it? Let's see if we can get the aortic valve here. Here's the aortic valve, the 3 valve cusp. Is it seen well? 3 valve cusp. Okay. 3 valve cusp are visible. There's the left coronary artery, right coronary artery, and pulmonary artery here. Not so bad. Only this part is a little bit prominent, as was in the X-ray. Again, I think we are reading a little bit too much into it because of his symptoms. Particularly that striking pose in the OPD which he gave, like squatting. All the time he was squatting. As if he was standing, he was having giddiness. So we thought of HOCM and all that, but looking at this echo, there is not much of, there is some hypertrophy given that he is 41, and there could be some very subtle abnormalities which might again indicate diastolic dysfunction. No way to really tell on the 2D, and that can only explain his S4 and his symptoms perhaps, but his symptoms are most of a lot of anxiety overlap. So it's a very interesting complex patient where it's not a clear-cut HOCM at all. Then in the parasternal long axis you can see a hint of LVH and LV dilation, but definitely not anything that you would see in a HOCM. Okay, and this is the 4-chamber view. Now in the 4-chamber view, this apical area, if there is any very significant issue or not, needs to be seen. Well, whatever it is, I wouldn't give it a lot of significance, but given his alcohol consumption and his symptoms, and of course overlapping with anxiety, it's an interesting clinically complex patient where the heart also figures prominently, but on examination, clinical and bedside echo, we are not still very much able to pinpoint the etiology.